And welcome you to Ibn Sina and our behavioral health team. So this morning, I'm hoping that you tell us a little bit about yourself and your areas of expertise. I do understand you're already seeing a lot of our patients, and so we're very delighted to have this conversation together. So give us a story. How did you end up in this career and this specialty specifically?
Let me introduce myself with relevance to what I'm doing today in this clinic. I'm from India. I went to medical school in South India in Andhra Pradesh. We started medical school early, 16 years of age.
Oh, wow.
I learned English on the radio. God bless Frank Sinatra,
Oh.
Nat King Cole, the Beatles, BBC World Radio, listening to cricket commentary.
Okay.
Because I went to a Telugu, my native language medium school. So for me, English was the major weapon, instrument for the rest of my life.
Okay.
And then halfway through medical school came God, a screen guard called James Bond.
Okay.
I read all of Ian Fleming's books, watched all of the James Bond movies. Through those and World War II movies and American hit parades, I learned English. Excellent. So compared to my compatriots, I know a lot more about history, the Cold War, the role of the United States in World War II, and what happens in America was of great interest to me.
Okay.
So my life is entirely full of curiosity related learning. And for us, being sent to medical school at age 16 is automatically you become a doctor.
Yeah, well, you make it sound very easy, but
yeah, in a way it was. Plus, it was free.
Okay, that's a good incentive.
It was free. If you read about me, you will see my entire theme in my life is parent education, patient education.
Yes.
Luckily, when I came to America in 1975, I had a series of residencies and fellowships in New York City at Columbia University in pediatrics, neonatology, and pediatric neurology. Okay. I was the first neonatal neurologist in America.
So what attracted you to neurology specifically?
I was living and working in a small island in the Caribbean called Antigua.
Oh.
I was a young, relatively new medical officer, first job outside of America.
Okay.
And we're in the delivery room at 2 a.m. and an 8.5-pound beautiful baby who was doing well until a few minutes ago, if it's asphyxiated, got stuck in the birth canal, cord complication or some complication, is delivered, is about to die, or will be brain damaged. So birth asphyxia, an asphyxiated baby, was what got me into neurology.
I see.
But there's a problem. You need training. So I was able to come to America, trained in pediatrics, neonatal perinatal medicine. Halfway through that fellowship at a major hospital in America, Columbia Presbyterian, my neurology mentor opened my eyes. Kairam, you want to do birth asphyxia research? You have to be a neurologist. So I did another 3 years of training. That's why I said I was the first neonatal neurologist in the United States. Excellent. But in 1982, something extraordinary happened in America. A new disease came, HIV.
Oh, yeah. Yeah, that was...
A child born to a mother who was not dying or doing poorly because of HIV will either die or be damaged, or even if that baby escaped HIV, would still be subject to the other things she did to herself. Poor care, drug use, alcohol, cocaine, etc. I became very involved in care and management of children affected by HIV.
Okay.
But to do that, you have to go to a place where there are more of those cases.
Right.
So I left Columbia University. Much to the disdain of my family and wife, I went into the South Bronx in New York City, worked for the next 10 years in AIDS.
Oh, wow.
Dying babies, dead babies, foster care, terrible situation. Many people forgot what it used to be like.
Yeah.
Out of that came an interest in children who are not doing well. They were called seroreverters, meaning they were antibody positive at birth,
Okay.
but not infected. So the antibody disappears by 10 or 15 months. So the child is now 2, not doing well. And he's now 5, not doing well. But the mother is dead,
Okay.
was raised in foster care, not doing well. So such children, although lucky not to be killed by HIV virus, survived to suffer the consequences of bad pregnancy, poverty, etc.
Yes. Yes.
So, in come Miss Elizabeth Taylor,
Okay.
famous actress, very
Yes.
rich, gave us a grant of $250,000. So I developed an exclusive clinic. I developed it. It's called
Okay.
Program for Children and Families. In those days, if you had an infected woman, dying husband, or half-dead boyfriend, 2 more children at home, you tell her, come to immunology clinic at 9, GI clinic at 10, see the social worker at 12, and see the neurologist at 2. She can't make it.
Yeah, there's too many.
So I brought all of them to one apartment building outside the hospital. I had all the providers there, and she would come, get her some food and drink and babysitter, so she can handle all of those. It's called
Oh, wow.
Program for Children and Families. It was unique, a one-stop shopping center.
Yeah.
How could I do that? My bosses were very kind.
Yeah.
They let me do what I want. Subsequently, the president of my hospital connected me with Congressman Jose Serrano Jr., ranking member of the Senate Appropriations Committee from our neighborhood in the Bronx. He got me a $1 million grant.
Okay. So that became the concept of. Yeah.
That's how I developed the first ever child study center for poor people. There was already a child study center at Yale University for people with money. There was another child study center at NYU, New York University, for the wealthy. But mine was a child study center for poor people.
Right.
And against all medical advice, all science, they said Tylenol given to a pregnant woman will cause autism. Having spent the last 25 years in autism, I am particularly upset about this development, and I have been a patient educator.
Yeah.
I created a community health education center in the Bronx.
Okay.
I converted entire residency training programs, so my residents coming out of my program become educators. In academic failure, the only program in New York City where the residents ask a report card.
That's
My
great.
practice in Manhattan, I was known as a report card doctor. If I see a lady with a 7-year-old on the street, I recognize him and say, hey, where's the report card? And he said, Ma, what is that? Well, he told you last time.
Yeah.
No, sir, he messed up again. Okay, I want to see you next week.
Okay.
So I got involved with education.
Okay.
So what's a pediatric neurologist, a neonatal neurologist doing in education? Ma'am, education is everything.
Yeah, you
We
can
only talk
prevent a
about we
lot.
only talk about poverty.
Yeah.
Poverty makes you not educate your child well. Your child not well educated becomes poor. It's a cycle.
Yeah. Yeah.
Unfortunately, in our medical care system, the doctors and the hospital do not believe that's your business. They're only looking for the asthma attack and the child with diarrhea and dehydration.
Yeah.
We do not pay enough attention to education.
The root cause. So what would you tell parents, like what to look out for? Like what are some early signs?
Normal development. A mother must learn
Okay.
what is normal development of a child. My child is 3 years old, is not talking. That's not normal.
Okay.
My child is 18 months old and he still is crawling on the floor. He cannot pull himself to stand. Most mothers, either pointed out by the grandmother or somebody, will say,
Yeah.
"Oh my God, I need to get help." They go to the doctor to ask those questions.
Yeah.
They're
Yeah.
not doing that. They're not doing that. It's amazing how many 3-year-olds spend the whole time in the clinic on their device, on their iPad
Yeah.
or on their phone.
Yeah.
If you don't give it to him, he throws it down. $1,600 iPhone, the angry kid throws it. Why did you give it to him in the first place?
Yeah.
Bad things are happening.
Yeah, there's a lot of the sense of normalcy has changed, I think, with parenting, with technology being in the picture. What about behavioral outbursts? Like, a lot of times as a counselor, we get calls about just fix my child, they're misbehaving. So, can you talk a little bit about those
Yes.
kinds of
Yeah.
nuances?
For that, there's a reason.
Okay.
We are in a clinic with a doctor. You're going to pay the doctor. The doctor must not end up saying developmental delay, speech delay, speech disorder. That's what he says, because all of them have an ICD code.
Yeah.
Ma'am, developmental delay is not a disorder of your stomach. Speech
Yeah.
disorder is not a disorder of your gastrointestinal tract. It's a brain disorder.
Yeah. Yeah.
It should have a diagnosis. Speech delay due to mental retardation, serious problem.
Right.
Speech delay due to autism, serious problem. We are in many pediatric clinics, they are seeing 3 to 4 children per hour. Medical assistant,
Yeah.
height, weight, BMI, dental screening, vision screening, shots, see you in 6 months. Really?
Like
What
an
about
assembly line.
no? What about development?
Yeah.
What about report card? But it's difficult. It's difficult. So what did I do? There, I had a community health education center.
Yeah.
I brought people into a room. I developed an autism treatment and advocacy center, teaching parents about the IEP.
Yeah.
Under the law, what is the child entitled to? How do you prepare to go to the IEP meeting? What should you be asking?
So IEP is the individualized education programs.
IDEA, Individuals with Disabilities Education Act, 1991. It mandated a child with disability must be educated in the manner in which he knows how to learn, not to be forced to be educated in the manner in which the teacher knows how to teach.
Yeah, the environment.
It's a law.
Yeah.
Therefore, to implement that law, a child must have an individualized education plan. As part of that, there is a diagnostic process, an evaluation as to what is wrong with him. Maybe he only has speech articulation disorder.
Yes.
But he's intelligent, he's nice, he's sweet, that's different. Or maybe he has autism, that's serious business.
Yeah.
But my parents do not know that.
Yeah, the difference. I mean, that's the thing. One of the reasons we want you to help us understand is how to look for these, how to become advocates for our children.
Screening. 18 months, MCHAT, modified checklist for autism in children.
Okay.
In toddlers, sorry. If he fails it, he should have an evaluation. It's amazing. I've been here for 5 years. How many children failed the MCHAT screening but never went on to have evaluation for autism?
Is that something you do for parents?
No. I educate. I tell the parent what may be wrong. I point in the direction of where to get an autism evaluation. One particular company, Action Behavior Centers, has been very kind to me now for 4 years. They have done about 1,100 autism diagnostic observation schedules for free.
Okay.
But once the child is diagnosed, then I push to get therapy.
I see.
But at a minimum, the parent must be educated.
Yes.
She could
yes.
be frustrated, she could be angry that she's not getting therapy. But madam, you have to learn.
Yeah. So what does a first session look like for a parent who's like suspecting maybe their child is not on
Questions. There is a test that is very well known in the field internationally. It's called Childhood Autism Rating Scale. 23 questions. Yes, no, yes, no, yes, no. That's what we will be doing
Okay.
to screen the child for autism.
Okay.
And if he fails it, then I send him for autism diagnostic observation schedule to conclusively diagnose autism.
Okay.
And is it a level 1, level 2, level 3, how much support he needs. But my problem is the parent herself had not even suspected it because she's been carrying it as speech delay, speech disorder. So first visit takes
Mislabel.
time. Why am I with Ibn Sina? I will not have a boss. I won't have a manager telling me, oh, Dr. Kairam, you spend too much time with that mother.
You
Sometimes
get to
I
do
spend an
good
hour.
work. Yeah.
Now I do video work. I get calls from Dallas or New York. I do online
Educating.
consult.
Okay.
Nobody telling me it's 1 hour is up.
What would be, what are some ways that people can get involved in some of these educational forums? Would you have to be a provider, or can parents always like chime in?
A community center, a waiting room, a church hall. That's what I've been doing.
But what message would you have for parents that, with young kids, knowing the work that you've done, knowing the patterns you've observed? What are some messages you would want to share?
Read about your child. Learn about your child. Compare him with his nieces and cousins and the neighbors' kids.
Okay.
Compare him with the other children playing in the playground. Read about it. Read about child development.
Okay.
God bless the internet. You can
Easy
get
access to
so
info,
much
yeah.
information about normal child development,
Yeah.
normal language development. When should a child be toilet trained?
Those milestones,
all
yeah.
of these things are taught to you by your aunt, by your mother, by your grandmother. Ask questions.
Yeah.